Thanks, my question is, in view of many skills shortages positions within the health sector in Ireland, would it be possible to look at a 3-year academic degree with the 4th year completed in practice? This will alleviate the lengthy waiting list for children, for example, in speech therapy, child psychology, orthodontal and many other areas.
Interesting question, and genuinely to be trying to grapple with everything that we can possibly do together to try and reduce waiting times and increase the supply of professions. A key focus of what we call funding the future, our funding plan for higher education, is to ensure that we have an appropriate pipeline of suitably qualified individuals to enable the provision of essential public services in areas such as health and social services that you've referenced. This priority is now being advanced by my department in relation with higher education institutions. It is important for me to say, it's very important for me to say that they are autonomous in relation to an academic affairs, including the design and structure of programmes they offer. So I quite rightly, and to reassure the House, don't design academic programmes, they're structured, they're designed. This is a very important safeguard of quality, and I know the Deputy would appreciate that. The programmes put in place and delivered by higher education institutions must also conform to regulatory standards required for professional accreditation. So, for example, CORU is one of the regulatory bodies, the Nursing and Midwifery Board of Ireland being another, to ensure that their programmes meet relevant standards. Clinical placements are arranged by individual institutions, the HSE and other healthcare providers. But what I can do and am doing, Deputy, and I want to assure you of this, is trying to work with other government departments to identify the skills needs. So I'll give you one example. We started this with medicine this year. We've sat down with the Department of Health. We've asked them the question, how many doctors do you need to be training in Ireland? They've given us a number. We'll be publishing that number very shortly. It'll be a multi-annual figure, but we've announced 60 more places from September in medicine. I think we announced about 3 extra last year, so to give you a size of scale. I now want to do the same exercise with the Minister for Disability, with the Minister for Children on speech and language, on OT. I'd love to stand up here and say I can slash a year off the course. I can't. But what I can do is make sure we very significantly increase the places so that we train an awful lot more people in these areas. And I'd be happy to engage with you further on this matter, Deputy.
While I do realise that you have opened up extra places in research throughout the Innovate Ireland programme, for Ireland programme, there has to be further openings within the postgraduate programmes. For instance, nursing, where psychiatric nurses have worked in practice for many years in different specialty areas. They could provide therapeutic roles and alleviate a huge backlog in child and adolescent services areas, which are currently at 3,914 children on waiting list. Nursing and teaching have merged their work placement very successfully, and it has helped their in-staff shortages. So, Minister, from the point of view, and I've said it there again, that the nursing and teaching have merged their work placements, and that has worked very, very successfully in the training of extra people, and also has helped with staff shortages and waiting lists for very vulnerable people. Thank you, Minister.
No, thanks very much, Deputy. And I must say, instinctively, I'm very sympathetic to the point you're making, that there's a real urgency here to people, for all of us, for regulatory bodies, for universities, for clinical placement providers, to try and be innovative here and try and absolutely protect and safeguard quality, 100% professional standards, regulation, but to see what role everybody can play in terms of increasing the supply, because this isn't about numbers, as you rightly say. It's about a child waiting to see a speech and language therapist or an occupational therapist, or it's about a person waiting for a psychiatric appointment or psychologist. These are real pertinent issues. I just don't want to mislead you, because and I'm not trying to be unhelpful, I don't have a role in saying you must reduce the length of the course from 4 years to 3. I would suggest the conversation you've had with me could usefully be had with other line ministers and their regulatory bodies. But what I absolutely do have a role from, I won't shirk my responsibility in this, is doing something we haven't done in this state properly before, which is workforce plan. How many speech and language therapists you need, how many OTs, how many physios, how many doctors, how many nurses, and how are we going to increase the pipeline to deliver those? So that's the way I might be able to help you.
In order for a 3-year degree to happen, the colleges and the universities will have to need more supervised placements in all allied health areas, such as language therapists, nursing, midwifery and psychology. Qualified people will be needed to supervise the placements. Surely this is a real possibility for many critical skill shortages within the health areas. The ultimate huge benefit is for the children waiting list and the growing longer every day. Has the Minister looked at the CAO system in conjunction with the skill shortages in the HSE, and has he examined opening up further places in universities and colleges in order to meet the industry demand in the health sector?
Yeah.
Thank you.
Now we're talking on something I can definitely help with. So yes is the short answer. So this year we announced 1,056, I think, additional places in college from September. We didn't do what we've done in previous years, we just announced a kind of large global number. We've tried to target them at areas where there's a critical skills needs, particularly a public services skills need. So there are more nursing places this year, well over 100. There are more medicine places, I think the biggest single increase ever, or certainly in a very long time. There are more therapy places, though not as much as I'd like. So the next thing is definitely do this workforce planning exercise, so that when we go to increase the size of higher education next year, we look at targeting the areas where there is skills needs, and you've identified a number. There's another area that we can help, and I think it's an important area, which is further education and training. So if you look at speech and language therapy, a really important discipline, a really important profession, there's also a role, though, a speech and language therapy assistant that we can provide through further education and training. And I think the more you can expand the system in general, for some children, for some adults, a speech and language therapy assistant might be able to play a very helpful role. They'd certainly be able to support the speech and language therapist. So that's definitely an area I'm really eager in exploring, because I think there's something quite quickly we could do there.